A new study finding that the coronavirus may be transmitted through the eyes. This finding comes just as the FDA clears the way for at-home saliva testing. Meanwhile, a new clinical trial at Stanford is trying to find out if medicines like hydroxychloroquine were given almost immediately after infection, would they be more effective? Joining us to discuss all of the above, cardiologist and author Dr. Chauncey Crandall. His new book, Fight Back, is available for pre-order on Amazon right now. Also with this, emergency medicine physician and co-founder of the telemedicine provider Remote Health Solutions, Dr. Jonathan Baugh. Dr. Baugh, let me ask you about the saliva test. Why does this matter? I have read that the accuracy is maybe 85%, I think that's about. Why is it important to be able to offer that when, you know, it's not 100% or 99% accurate?
Well, what you're talking about is the sensitivity, how well it's measuring the fact that you do have that disease. So at 85%, what I've actually been reading is that is an increase from our nasal swab testing. And that's an important thing for us to be able to do, to be able to have this test at home. It's something that people are more willing to do. It comes with great instructions, and they're able to, spit into a little vial and send that saliva back. And it's not as invasive as that swab has been in people's nose and their nair deeply.
So, Dr. Crandall, now we want to revisit this idea of the coronavirus entering the body through the eyes. Knowing that's a possibility, what do we need to keep in mind?
Well, the main thing is we know that we need to have strict hand washing because our hands bring the virus to our eyes, to our nose, and even to our mouth. So hand washing is key. And this can prevent the virus from being spread to the eyes or other areas of the body.
Is there a connection between pink eye and coronavirus at all?
Well, there is. We know that, viral infections commonly in children can give pink eye. So any form of pink eye or eye irritation, we need to think immediately that this could be coronavirus, especially in today's environment out there.
Dr. Baugh, does it matter if somebody gets a test and finds that they have antibodies? Why is it important for people to find that out, whether they have it or not?
Well, what we know is that your body forms these antibodies after exposure to viruses. And this is something that we've known for a long time, obviously. What we don't know right now is how long that resistance is for. And we just don't have good data about that yet. But what we do know is it does give you some resistance, and we just don't know the duration. But that's how we're going to be able to measure our herd immunity that we've talked about so much, because as more and more individuals have this immunity against COVID-19, then the ability to be able to spread from one person to the next person and go throughout our society and go through our community dramatically decreases until we get to a point where there still are going to be people who haven't had it, but they're just not going to come in contact with somebody who does have it nearly as much. It's the same principle of having vaccines and vaccinations for kids in school.
Dr. Crandall, I want to ask you if you're learning anything more about why someone would be asymptomatic, so to speak, yet someone else. I know there are other underlying health issues that can make someone more susceptible to the illness, but in particular with being asymptomatic, is it about the immune system being strong, or is there perhaps more to it, something like our DNA?
Well, I think we know right now that younger people often can be carriers, and they are asymptomatic, but a younger person has a very intact immune system. So there's a balance between the virus and the immunity where they don't get sick versus an older patient who we know, and what we've seen in the nursing homes, is that their immune system is compromised. They're older, they're not as strong, and they cannot fight the virus. So yes, there are carriers that are asymptomatic. Usually they're younger people, and in general, they're in much better health.
And Dr. Baugh, if somebody has had COVID-19 and does have antibodies, can they nonetheless be carrying the virus to someone else?
Well, that has to do some with what antibody testing we're looking at. So we talk about a couple of different types of antibodies, IgG and IgM. And so we've got early immunity and we've got late immunity. So you could have a positive antibody test that signifies that you have had or have recently had the COVID-19 and still be a carrier. But once we gain sort of later antibodies, that means that we've recovered from it. And so those are important things to be able to differentiate. And most of those antibody tests that I've seen differentiate between the IgG and IgM antibodies as well.
Well, I guess what I'm asking is if you have the late ones that you're referring to, somebody's not going to be carrying, like have the virus on them and carry it to someone else, correct?
Correct, because at that point now you become immune and you're not carrying the virus anymore. It's not in your system.
Got it.
Dr. Crandall, what message do you want to send to folks watching at home and the public as states are reopening and as we start approaching normal? What are some of your greatest concerns and what message do you really want to hit home?
Well, we know that as we open the environment up, people are going to get sick with this virus. So we want to be concerned about those that are most vulnerable. Those would be the elderly. Those would be those that are diabetic and those that have obesity and those that are immunocompromised. That segment of the population must remain isolated and very protected. The young people and those that have an intact immune system and no systemic disease, they can go out into the environment, but we still need to protect ourselves. Strict hand washing, prevention from touching our mouth, our nose, our eyes, and taking precautions that we're not in large groups.
Dr. Baugh, Sweden, Japan, they are examples of countries that have not locked down and have gone about their business. Now, Japan is notorious for wearing masks. They're going forward saying eventually everybody's going to be exposed. We're going to get that herd immunity, and this is the best way to go about it. What is your response to their approach?
Yeah, if we look at Japan, if we look at Sweden, Sweden's a little bit of a different story as well. But when we look at Japan and their prevalence of wearing masks, I think they did a really great job in wearing those masks. And we talk about underlying health conditions, and we talk about obesity, and we talk about diabetes, and we talk about proximity of patients to each other. All those things are a factor here, and we won't know yet what makes the difference from country to country. It's going to take us a few years, but I do agree with the idea that at this point, we know that everybody's going to get exposed, or 70% of people are going to get exposed in America, and we need to be smart about how we go about this. We need to open up regionally. We need to be doing the hand washing and the social distancing and all those things to protect those people that are at risk, like Dr. Crandall talked about. And we can still use the example of other countries and be smart about it. But we have to remember that that those people who are going to be most at risk are those that are going to be sickest. And we may have a higher population of some of that obesity and diabetes here than some of the other countries that have been an example.
Okay, fantastic advice. Dr. Jonathan Baugh and Dr. Chauncey Crandall, thank you so much for being with us today.